Hey guys, welcome to my channel. So this is a video on pelvic neuroanatomy. This is very important to understand the steps of the radical hysterectomy and also the types of the radical hysterectomy. So this is a part of a series of videos that I'll be making in the coming days. We'll start off the topic with pelvic anatomy. So this is anterior and this is posterior. So anteriorly we have the urinary bladder. This is uterus and cervix, and this is rectum. So the tissue adjacent to the uterus is called parametrium. So we have three parametrium. One is the anterior parametrium, and the lateral parametrium, and the posterior parametrium. Anterior parametrium is also called as the vesico-uterine or the vesico-vaginal ligaments because they connect between the bladder and the vagina. The lateral parametrium is also called as cardinal ligaments, through which passes the uterine artery, and the posterior parametrium is also called as recto-uterine ligaments or uterosacral ligaments. This dorsal parametrium also called as the uterosacral ligament, and this is lateral parametrium also called as the cardinal ligament. This is the anterior parametrium also called as vesico-uterine ligament. These are further divided into spaces again. So the anterior parametrium, which is also called as the vesico-uterine ligament, it is divided into two halves, which is the medial half and the lateral half, by the ureter passing through it, as you can see in this image. And the lateral parametrium is divided into superior and inferior portions by this deep uterine vein. The deep uterine vein divides this lateral parametrium into the superior and inferior parts. The superior is also called as pars vasculosa. The inferior part is called pars nervosa. Pars nervosa contains the pelvic splanchnic nerves, and inferior hypogastric plexus. Pars vasculosa contains the internal iliac system. So with this basic knowledge in mind, we will start off with the pelvic neuroanatomy. This is the image taken from one of our surgeries. So this is the common iliac vessels which are dividing into external iliac and internal iliac. And you can see the ureter passing through the common iliac vessels and entering medially. And here you can see the hypogastric nerves. And just when you compare this image to this, you can see the ureter here and the hypogastric nerves passing through the uterosacral ligament. We'll see these in detail in the next slide. Yes. So here we see the aorta, IVC, and just below the takeoff of the inferior mesenteric artery, the superior hypogastric plexus are present, and they're present from there till the S1. This is all composed of superior hypogastric plexus. Superior hypogastric plexus are formed by sympathetic outflow. There is sympathetic ganglion present on either side of the vertebra, so these give supply to the superior hypogastric plexus. This is the bifurcation of the aorta. It divides into right and left hypogastric nerves. So this is the left hypogastric nerve and this is the right hypogastric nerve. You can see these hypogastric nerves pass through the uterosacral ligament and they form the inferior hypogastric plexus at the level of the paracervical tissue. This is where inferior hypogastric plexus are formed. So how are these plexus formed? So when you see the autonomic nervous system, it is divided into sympathetic and parasympathetic. So the sympathetic system is composed of sympathetic ganglion that run on either side of the vertebra, and they are present in the thoracolumbar region, and they descend into the pelvis. And in the pelvis, They are called as sacral splanchnic nerves. Then coming to the parasympathetic system, it has craniosacral outflow. Cranial is the vagus nerve coming from the brain, and the sacral outflow, that is S2, S3 and S4, gives off the plexus and which form the inferior hypogastric plexus. So the superior hypogastric plexus are formed at the level of the takeoff of the inferior mesenteric artery, and from here they present till the S1, and from here they give two divisions, the right and the left hypogastric nerves. Superior hypogastric plexus therefore are predominantly sympathetic, but they do have some ascending branches from the inferior hypogastric plexus. The inferior hypogastric plexus are formed from parasympathetic divisions from S2, S3 and S4. But they also get sympathetic supply from the sacral splanchnic plexus. And this is about superior and inferior hypogastric plexus and the hypogastric nerve. So now you can see in this image, this is the superior hypogastric plexus which are present till S1, and then they divide into right and left branches giving to each hypogastric nerve. Sometimes there could be presence of accessory hypogastric nerves, and this hypogastric nerve then reach the inferior hypogastric plexus. This inferior hypogastric plexus again divided into superior, middle and inferior. The superior part supplies the cervix and uterus, and the middle part supplies the urinary bladder and rectum, creating a sensation of fullness. The inferior portion supplies the contractor muscles of rectum and bladder, which are helpful for defecation and urination.